EHR Adoption Challenges by Sarah A. Carlton. Health information technology has been growing and developing since the early 1990s. These technologies have allowed healthcare providers and organizations to maintain more comprehensive patient records, correlate clinical information to billing and coding practices, and collect data that can be used to help increase the quality of healthcare while decreasing healthcare costs. The widespread adoption of electronic health record systems, as incentivized by the Health Information Technology for Economic and Clinical Health, or HITECH Act of 2009, has paved the way for further studies and the development of best practices on how to use these EHR systems to their maximum potential. Health information technology continues to drive healthcare forward toward the triple aim of improving the patient experience of care, improving the health of populations, and reducing the per capita cost of healthcare. But its development has also seen some challenges along the way to achieve these goals. Benefits to electronic health records include better coordination of care, the option for computerized physician order entry, or CPOE, with clinical decision support, and the opportunity for predictive modeling or real-time data analysis to support population health. Coordination of care is improved through easier communication from provider to provider, as well as from provider to the patient or patient's care team. This communication is accomplished through capabilities such as integrated messaging systems within the EHR and patient portals that allow the patient to access their own health information. Better coordination of care can lead to less duplication of diagnostic tests and imaging, as well as a decrease in medication errors due to all providers having access to a patient's comprehensive health record. Computerized physician order entry systems allow clinicians to enter orders for medications directly into the patient record to be automatically sent to the pharmacist. If the prescription conflicts with the patient's allergy list, current medications, or other factors such as weight, age, comorbidities, etc., a clinical decision support system can flag the prescription and make the clinician or pharmacist aware of the conflict before the prescription is given to the patient in error. Data collected via EHR systems can be used to predict future health risks of a population or be analyzed in real time to address the current health needs of the local populations. Challenges to electronic health records include interoperability, usability, and health IT safety issues. Interoperability, or the ability for EHR systems to talk to one another, remains a problem from one system to the next. The goal of interoperability is for data to be able to transfer seamlessly from one source to the next. This would include making data from daily living settings, such as nursing homes, available through the integration of the Outside Resources Program to the health system or hospital EHR, so that the data can be utilized when deciding treatment options. Usability is another challenge due to physician overload and burnout. Productivity can actually decline when clinicians experience burnout from the overwhelming amount of information and the technicality involved in EHR workflows. Lastly, health IT safety needs to be a major consideration when transferring data from one source to another, as to not violate HIPAA guidelines or fall susceptible to cybersecurity threats. Meaningful Use was established as an incentive program through the HITECH Act of 2009. This program sought to align incentive payments with the demonstration of improved performance measures and patient outcomes resulting from the use of a certified EHR. The Meaningful Use program was deployed in stages. Stage 1 focused on data capture and sharing and was implemented from 2011 to 2012. Stage 2 was implemented in 2014, and its criteria were intended to advance clinical processes with more rigorous health information exchange and increased requirements for e-prescribing, as well as incorporating lab results. Stage 3 took place in 2016 and involved criteria aimed at showing improved outcomes and improving population health. As of 2015, more than 482,000 healthcare providers received a total of over $31 billion in payments for participating in the Medicare and Medicaid EHR incentive programs. The Medicare Access and CHIP Reauthorization Act, or MACRA, will build on meaningful use by introducing a payment model based on a merit-based incentive payment system, or MIPS. Reimbursement through this payment model is based on a certain performance score and will fall into a neutral, positive, or negative category based on the decided threshold. The threshold is calculated by judging performance across the categories of quality, costs, improvement activities, and advancing care information, previously meaningful use. Those providers or practices that fall into the neutral category will receive the normal base rate payment for Medicare. Those who fall above or below the threshold will receive either a 9% bonus payment or a 9% decrease in payment from the base rate from 2022 onward. Healthcare organizations may choose not to update their EHR systems or rely on older legacy systems that are already in place. This can happen to avoid the high costs involved in replacing the system or to avoid losses in efficiency due to having to learn a new EHR program. Although these seem like significant benefits, retaining a legacy system can also come with many consequences in regard to maintenance and sustainability. Aging IT infrastructure and applications are prone to instability caused by failing components. This instability can cause disruptions in service as well as high repair costs due to lack of support, availability, and a limited number of people with the necessary knowledge and skills to service these systems. Legacy systems may also be unsupported by their suppliers and no longer receive bug fixes or patches to address security weaknesses. Over time, these systems may be harder to adapt to the changing healthcare environment and not be able to keep up with the data capture and reporting requirements regulated by government programs such as Meaningful Use and MACRO, which were discussed earlier. These consequences can impede IT and care advances and result in a larger cost to transition to a cloud-based system at a later time, as well as penalties accrued by failure to demonstrate performance improvements. There are a few barriers that may prevent an organization from adopting a new or updated EHR system. These systems require a time investment for training office staff and physicians on the new EHR system. The transition can also take time away from those tasked with creating an implementation plan and working with the vendor to align the needs of the organization with the program itself. These systems are also costly and require significant financial investment to adopt. There may also be a loss of productivity when the new EHR system goes live due to the learning curve needed to adjust to the new program. Physician acceptance can also delay the adoption of a new EHR system. If physicians are not receptive to the new EHR adoption initiative, the organization may experience delays in achieving meaningful use, incur EHR re-engineering costs, and even consequences such as poor patient outcomes or financial losses. This is why it is important to ensure that the physician needs and concerns are addressed in the EHR implementation initiative to help drive a smooth EHR rollout. An EHR system needs to meet the needs and objectives of the organization. This is why it is important to research all options before settling on an EHR program. Objectives need to be clearly defined and system requirements need to be prioritized to figure out the most important needs are. All options need to be explored before deciding on a purchasing option. It may be more beneficial to leverage someone else's IT infrastructure or build a custom application, for example. The next step would be to obtain and evaluate vendor proposals on a set of predetermined evaluation criteria. A cost-benefit analysis would then need to be performed for each proposed system to help narrow the choices to 2 or 3 vendors. A summary report can then be prepared ranking the vendors from first to last choice so that if the first choice falls through, a new vendor can be immediately selected. Finally, contract negotiations can begin to determine expectations and performance requirements, delegation of responsibilities, when the final product will be delivered, any customization needed, confidentiality requirements, and when payment is due. The implementation of the EHR system must also follow a well-developed plan to be successful. First, an implementation team needs to be organized who will work together to clearly define the project's scope and goals. Accountability needs to be determined so that management of the different parts of the project can be delegated to a business sponsor, a business owner, a project manager, and an IT manager. Each of these people have different responsibilities in maintaining the timeline of the project and mitigating any delays that may occur. To further maintain the timeline, a project plan must be developed to outline major activities, milestones, durations, dependencies among activities, resources, and budget needed, team members responsible for tasks, and target dates for completion for each step in the project. As previously mentioned, leadership and physicians must be on board with the project plan for it to be successful. With support from these key stakeholders, as well as proper training, resistance can be limited and successful adoption can take place. In conclusion, new or updated EHR systems can provide many benefits to an organization through better coordination of care, CPOE and clinical decision support capabilities, and the collection of data that can be analyzed to improve population health. Laws such as high-tech, Meaningful Use and MACRA have worked to align the use of EHR systems to improve patient outcomes and alternate payment models so that clinicians are reimbursed for the value and quality of their services versus the amount of services they provide. Adoption barriers such as time, cost, and physician acceptance can make the transition to a newer updated EHR system very difficult. Successful adoption can be achieved, though, through proper planning, leadership support, and the alignment of the new EHR system with the needs and objectives of the organization it will serve.